Hi, my name's Manoj, Krishna. I'm a spine surgeon, and today I'm presenting a case of lytic spondylolisthesis. This is a situation where a vertebra slips forward on the other, as can be seen on this MRI scan on the red arrow. And this is because there's a defect in the back of the vertebra in the lamina, or an area called the pars interarticularis. The cause of this is not clearly known, but as a result of this forward slip, patients complain of chronic back pain and leg pain, as in this case. The CT scan here shows more clearly how the vertebra slipped forward on the other, and in fact, the disc space is also significantly narrowed. This lady was treated with a posterolateral fusion, where we put screws and rods above and below the defect and put some bone on the back of the spine. The surgery takes a couple of hours, and she was in hospital for 2 days. Here's Anne-Marie telling her own story. So good afternoon, Anne-Marie.
Good afternoon, Mr. Krishna.
So you've come a long way.
Yes, from Warrington.
Warrington, yeah. Okay. How long's the drive?
Around 2 hours.
2 hours, okay.
Yeah.
So, and how old are you now?
I am 57.
57, and one thing that nobody will believe when they look at you is you're a black belt in karate, right?
That's right, yeah. Yeah.
Isn't that amazing? Anyway, tell me a story about your back, please.
I've been doing the karate for about 7 years to date, and I noticed that 2 years ago, around the November time, that I was getting a lot of pain in my back. I was finding it difficult getting up and down and moving around. And then I went to the GP, who obviously sent me for a scan, and then I was introduced to yourself.
How did you find me all the way from Warrington?
It was a colleague. You'd helped a colleague's sister.
Oh, okay.
Yeah.
So I think you've tried a lot of conservative treatment in that time.
Yes, I had the spinal injection.
Okay.
It sort of suppressed it for about 3 or 4 weeks, but then it just went straight back.
And your scans showed that you had a slip forward of one vertebra on the other. So I advised surgery, and I think 3 months ago we did a spinal fusion for you.
Yeah, that's right.
Can you talk me through the surgery and how you are now?
Well, before I went for surgery, I had this enormous, and I call it an ugly pain, a really seriously ugly pain. I couldn't describe it anymore. And then the day after the surgery, I got out of bed to obviously go to the bathroom, and that I felt where I'd had the operation, but the ugly pain had gone. Okay. I have never ever had it back, never. And
then, how long have you taken to recover from the surgery?
This is 3 months now. I was up and about and walking. I was home within 2 days. Walking around. My husband's obviously helped me, but we've been walking around Llandudno and everywhere, and I feel absolutely brilliant.
Okay, so no pain?
No pain from the back at all.
Okay, and I think you've just got a bit of tightness in the foot. And that's it.
Yeah, it was sore, it was difficult to move, it was numb and pain in the knee, then it travelled down the leg to the foot. The pain's gone, it's like a tight, numb, as though you've got a tight shoe on at the moment.
Okay.
But if that's all I've got to live with now, it's not a problem. It's nothing.
Thank you very much.
You're very welcome. Thank you very much.